What is the prior authorization status for Genotropin 12MG? Hey doctors, welcome back to the channel. Today, we're diving into a topic that's been a growing concern for many healthcare providers: prior authorizations, especially for high-cost specialty medications like Genotropin 12MG. We all know the drill. You've got a patient who needs this essential medication, but before you can prescribe it, the insurance companies are asking for a mountain of paperwork, documentation, and proof of clinical necessity. It seems like the process is meant to control costs and ensure proper care, but more often than not, it feels like the exact opposite, doesn't it? The delays, the redundant documents, the phone calls, it's all becoming overwhelming. In fact, the American Medical Association reports that a staggering 88% of physicians say prior authorization requirements interfere with patient care. And let's not forget about the 40% of practices that have entire teams dedicated to managing this paperwork, teams that are stretched thin, especially when it comes to complex meds like Genotropin. For those who may not be familiar, Genotropin typically requires a ton of documentation, including growth charts, lab results, imaging, an endocrinologist evaluation, patient adherence history, and sometimes even coordination with specialty pharmacies. When you multiply this by multiple patients and different insurers, it quickly turns into a full-time job. But here's the thing: there's a way to make this whole process a lot smoother, and that's where Staffingly comes in. They specialize in managing the entire prior authorization process from start to finish, especially for medications like Genotropin. Their team works to make sure all your documentation is in order, that insurer-specific requirements are met, and that follow-ups are handled efficiently. No more delays or denials slowing down your practice and affecting your patients. On top of that, Staffingly also takes care of insurance verification, so before you even start the PA process, they make sure you know exactly what your patient's insurance covers, including formulary tiers and out-of-pocket costs. This proactive approach means fewer surprises down the line and a smoother approval process. But that's not all. Staffingly also helps optimize your revenue cycle management, RCM. They track claim statuses, manage appeals, and ensure your submissions are as clean as possible, minimizing denials and helping you maximize your cash flow. And with their virtual staffing support for appointment scheduling, you'll see smoother operations, less patient confusion, and fewer no-shows. But here's the kicker: Staffingly provides all of these services at a fraction of the cost of hiring and training in-house staff. In fact, many practices see up to 70% in cost savings. Outsourcing with Staffingly gives you the flexibility to pay only for the services you need, whether it's just for Genotropin prior authorizations or more comprehensive support across the board. So, if you're ready to lighten the load on your team, streamline your practice, and focus more on patient care, consider reaching out to Staffingly. They've helped countless practices improve efficiency and save costs, all while keeping patient care at the forefront. Before I go, don't forget to like, subscribe, and hit that notification bell for more tips on how outsourcing can improve your healthcare practice. Thanks for watching, and I'll see you in the next video.